and there are 2 or 3 of us in the room who are very much more on the conservative side of things. And then as soon, like very first class, right out the gate, politically activist therapists announce their politically activist views that aren't really relevant to the class at all. And then it's like, okay, we've set the tone. These are the views. And then the rest of the conservative therapists in the room are like, okay, we're just going to keep our mouth shut and keep our head down and go on about business as usual. And y'all have fun with that. And I
What
think
are
that
oh,
I would
sorry.
say that's part of the problem in the therapy world and in the therapy field is that one small, very vocal minority gets to set the tone for what the point of view gets to be, and then alternative views are, and maybe it's just because of the area that I'm in. It's like, okay, like there's no perceived benefit to speaking up.
Yeah.
And there might be some small risk to speaking up,
Yeah.
or maybe even a major risk. Who knows?
Yeah. Like losing your license or something.
Yeah. So,
How do they frame it with the gender identity question? Like, how are they framing this conversation before it starts?
clarify your question, please.
Okay. So, like I'll give you one example. In my program, a professor was going off about how terrible the state of Texas is because they're limiting the use of puberty blockers for minors and all this kind of stuff. And then one woman in the class raised her hand and says, well, what if a kid goes on puberty blockers, cross-sex hormones, and then later changes their mind and like they regret their decision? And the professor goes, I never thought about that. It's like, there's this mentality of I know what the correct answer is, even if I don't know what the issue is, if that makes sense.
Okay.